Hello, this is Dr. David Bilstrom, and the question we're answering today is how can I get rid of chronic recurrent sinus infections from a functional medicine approach? Excellent question, because this is so common to get these recurrent sinus infections. Now, one thing you want to remember when you're talking about infections, you're talking about immune system disruption. Okay. Oftentimes we talk about autoimmune disease, but what we're really talking about is immune system disruption. And the disruption is you lose the set point right in the middle of the immune system, not too high, not too low. There's always a sweet spot in the middle of things. So if you remember, you have the set point right in the middle of the immune system, but when you lose the set point, you move away from it up and down. Up is autoimmune disease, as well as allergies, which could have something to do with sinus stuff, eczema, and asthma. Down here is cancer and infections. So if you're talking recurrent sinus infections, you're talking about disrupted immune system showing up as infections, including recurrent sinus infections. So we know the things that disrupt the immune system. So in a perfect world, you want to address the root cause of the whole thing, which would be vitamin deficiencies, hormone imbalances, or deficiencies, including estrogen dominance in women. Oh, hugely problematic. Infections of all kinds, cortisol issues, environmental toxicity, and the central mechanism of all of it being the gut. So you want to do that. But what you tend to see with recurrent sinus infections, people are actually kind of saying recurrent bacterial sinus infections. I may have chronic sinusitis. My sinuses are always kind of a mess, stuffy nose, postnasal drip, runny nose, all this kind of stuff, congestion, pressure. But then they go, oh, well, I keep getting recurrent sinus infections. I'm going to use an antibiotic. Well, what happens is the chronic smoldering infection is actually a mold infection, a candida fungal infection, yeast. And it keeps the tissues in the sinuses irritated all the time. Oh, I always have sinus issues. But then because that tissue, that environment is so disrupted because of the chronic smoldering infection, and your body really hates chronic smoldering infections, well, of course, a bacteria is going to jump in on top, and now you got a sinus infection that's bacterial. So you use an antibiotic. It kicks out the bacteria, but it does nothing to get rid of the chronic smoldering mold infection. So your sinuses still are an issue. Well, then bacteria jumps on top. You got to use an antibiotic again. It kicks the bacteria out. Still a disrupted environment. Bacteria comes in. Antibiotics. Boom, 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 boom. You end up on antibiotics over and over and over and over again. Well, the underlying mechanism is truly a mold infection. You got to get rid of the mold infection. Now, unfortunately, oftentimes, not only do people end up on antibiotics over and over and over and over again, but sometimes people are recommended to have sinus surgeries. Well, we'll go in there and we're going to open up the bony canals in your sinuses, and that'll take care of it. Well, part of the reason you don't have any airflow through your sinuses is the mucous membranes in the bony canals are so inflamed and so swollen, you can't get any airflow. You get rid of the underlying mold infection, the inflammation goes away, mucous membranes aren't totally inflamed. You got plenty of room for air to go through, but the sinus surgery will open up the bony processes. Well, you still got the underlying mold infection, you still got the sinus issues, and then people are recommended to get a second sinus surgery to open them up further. Well, they still end up with chronic sinus issues because you still haven't gotten rid of the mold infection. So how do you get rid of mold infections in the sinuses? Well, mold is stubborn to get out, whether it's in the gut creating issues, whether it's got into the systemic circulation, giving you things like joint pain, muscle pain, brain fog, fatigue, abnormal weight gain, gets in the sinuses, is stubborn. But you can get rid of it. So what we want to do usually is use pH structured silver solution as a nasal spray, a little atomizer filled with silver, 2 sprays, each nair, between 3 and 8 times a day, works great for getting rid of the chronic smoldering mold infection that's in the sinuses. Hopefully, long before you ever get a sinus surgery, once, twice, still works even after sinus surgeries, but it'll save you a couple different surgeries. But also what you find then is because you've gotten rid of the underlying chronic smoldering mold infection and all the inflammation that goes with that, yeah, your sinuses are totally happy finally, but you don't keep getting the bacterial infection over the top because you don't have a disrupted environment to allow the bacteria to come in on top. You stop needing antibiotics. You avoid all the downsides antibiotics have for your gut and your health in general. and your sinuses are finally clear. And it can be used for kids, it can be used for adults. Now, if you do get a bacterial sinus infection, because it happens every once in a while, because the pH structured silver solution is such a great broad spectrum antimicrobial, it will get rid of any infection, no matter what kind. So not only can it get rid of mold infections, but it's great at getting rid of bacterial infection. And so if you're somebody who, just has a bacterial sinus infection, you can also use that. Then you avoid the antibiotics. Then you avoid the tremendous negative hit to the intestinal microbiome that kind of mucks up everything. And you don't end up using antibiotics after all. Great question. Thank you so much.